Imagine a small tooth tucked away at the back of your mouth, the wisdom tooth. To many, it seems like a minor detail, an insignificant part of dental anatomy. But beneath this quiet exterior lies a potential chain reaction of danger that can escalate from a simple nuisance to a serious medical emergency. In this video, we're going to explore where the danger begins, how complications develop, and most importantly, how you can take control of your dental health with early diagnosis and proper care. A wisdom tooth is essentially the third molar, the last tooth to make an appearance during young adulthood, usually emerging between the ages of 17 and 25. Unlike other teeth, wisdom teeth are uniquely problematic because of their position in the mouth. They often don't have enough room to come in correctly. Sometimes they develop fully and are placed neatly, but many times they become impacted, stuck beneath the gum or bone, or emerge only partially, causing more trouble than expected. The very environment that houses a wisdom tooth is prone to friction and bacterial buildup, creating the perfect storm for dental complications. Now that we understand what a wisdom tooth is, let's examine why it poses more risks than other teeth. The location of this tooth inherently makes it more vulnerable to issues. With limited space at the back of the mouth, wisdom teeth frequently experience impaction. When a tooth becomes impacted, it is pressed against neighboring teeth or the jawbone, creating chronic pain and sometimes even decay between teeth. Additionally, a partial eruption means that a flap of gum tissue can cover part of the tooth, trapping food particles and bacteria. This scenario sets the stage for a bacterial invasion that can trigger gum inflammation, a condition known as pericoronitis. As we delve deeper, consider the sequence of events that can turn a minor irritation into a major medical concern. It starts with a seemingly benign gum inflammation around the wisdom tooth. Food debris mixed with bacteria gets trapped beneath the gum flap, eventually causing the gum tissue to become red, swollen, and painful. At this point, discomfort can be mistaken for a simple toothache that might resolve on its own. However, the reality is far more serious. Left untreated, this inflammation can evolve into a dental abscess, a pocket of pus that builds up as the infection worsens. This is when the pain intensifies, swelling increases, and the risk of the infection spreading becomes alarmingly high. In such circumstances, the body can react with fever, fatigue, and a general feeling of being unwell. There are even instances where the infection can lead to a dangerous condition known as sepsis, a life-threatening response to infection. One of the most serious complications that can arise is airway compression, where swelling in the mouth and neck can make it incredibly hard to breathe. So, what should you look out for? There are several warning signs that signal a wisdom tooth infection may be escalating into something more. If you experience intense pain that worsens over 2 to 3 days, notice significant swelling in the face or under your jaw, or face difficulty opening your mouth or swallowing, these could be red flags. An unusual strong odor emanating from your mouth or a metallic, pus-like taste are also indicators that the infection might be more than just a minor irritation. These symptoms point to a condition that requires urgent professional evaluation, as the infection could be progressing to a point where it affects your overall health. The next phase in this story unfolds at the dentist's office. Once these symptoms are observed, it's crucial to seek a dental evaluation immediately. When you sit in the dentist's chair, the first step is a thorough examination. Dentists often use imaging techniques like X-rays to assess the position of the wisdom tooth and to look for any signs of impaction, abscess formation, or other complications. If an abscess is detected, the dentist may perform procedures to clean the area, drain the pus, and control the infection. Extraction of the problematic tooth is often considered if it is impacted or if recurrent inflammation is a constant threat. It is important to stress that the decision for extraction is made carefully, taking factors such as the tooth's proximity to nerves and the maxillary sinus into account. The goal is to minimize complications and ensure the overall health of your jaw. For many patients, the idea of extraction might invoke anxiety, but it's essential to recognize that a well-planned extraction is a preventative measure. Dentists provide specific instructions on how to care for your mouth during the recovery period, such as gentle cleaning, proper wound care, and taking any necessary medications to avoid secondary infections. Follow-up appointments are crucial to monitor healing and to ensure that complications do not recur. While the above might sound alarming, remember that knowledge is power. Armed with an understanding of how wisdom teeth issues can develop, you can adopt smart prevention measures. A proactive approach is the cornerstone of managing your dental health. Start with maintaining excellent oral hygiene. Focus particularly on the back of your mouth where wisdom teeth reside. Regular brushing and flossing, reinforced by targeted cleaning techniques using water flossers or dental floss, can go a long way in preventing bacterial buildup. Regular dental checkups are equally important. By visiting your dentist periodically, you can catch signs of impaction or inflammation before they turn into serious problems. In addition to these routine measures, being vigilant about your own symptoms is critical. Don't ignore a mild discomfort that persists or escalates. Take heed. Your dentist's advice is invaluable in guiding you through the decision of whether to proceed with preventive extraction or to manage the condition with less invasive measures. Understanding when to act can prevent a cascade of complications that might otherwise affect your overall health. As we approach the midpoint of our discussion, let's take a moment to debunk some common myths that might cloud our judgment regarding wisdom teeth. One prevalent myth suggests that if left alone, the pain associated with a wisdom tooth will simply fade away on its own. In reality, while the pain might appear to subside temporarily, the underlying structural issues such as impaction or the gum flap remain, continuing to pose risks. Another misconception is that extracting a wisdom tooth will weaken your jaw. On the contrary, a carefully planned extraction performed by a skilled dentist does not compromise the structural integrity of your jaw. Lastly, some might believe that antibiotics alone can solve the problem. Although antibiotics help manage inflammation, they do not address the structural causes of the issue. Without removing the source of repetitive infection, the cycle inevitably repeats itself. By understanding these myths, you can make more informed decisions about your dental care. Knowledge about the true nature of wisdom tooth complications empowers you to seek timely and effective interventions. Let this information be a reminder that as our journey through the complexities of wisdom teeth comes to a close, remember this: a wisdom tooth is not inherently an enemy. It becomes a catalyst for danger only when issues such as impaction and inflammation are neglected. By understanding the progression, from slight gum inflammation to the risk of an abscess and even systemic infection, you gain the power to stop this chain reaction in its tracks. The combination of proper oral hygiene, regular dental checkups, and responsive medical intervention can ensure that what starts as a minor concern never escalates into a major problem. Before we finish, let's reflect on the larger picture. Our bodies are intricately designed systems where every part, even a small tooth at the back of your mouth, ignoring a persistent dental issue may seem inconsequential at first, but the potential for escalation is very real. Your mouth is the gateway to your body, and maintaining its health is paramount in preventing infections and serious complications. Visualize a diagram highlighted on your screen. The shaded region of your mouth where the wisdom tooth resides assures you that every preventive action you take, every thorough brushing session, every dental visit is a crucial step in safeguarding. We have walked through the life cycle of a wisdom tooth complication together, from its quiet beginnings to the alarms of infection. What you now hold is a deeper understanding of both the biological challenges and the practical steps required to manage them. Let this knowledge inspire a sense of responsibility for your own health and the health of those you care about. It is a call to action to not just passively accept dental discomfort as normal, but to actively pursue a course of preventive care. As we conclude this exploration, take a deep breath and let the knowledge settle in. Your mouth is a mirror to your overall health, and every small action matters. Stay vigilant, maintain your oral hygiene, and never hesitate to seek professional advice if something feels off. Early and proper care is the key to keeping your smile both healthy and bright. Seek dental advice immediately if you experience severe pain, swelling, or any warning signs, and maintain regular dental checkups to prevent complications.